Hey, it's me again, Alana, your student nurse. How are you feeling?
I'm feeling okay right now. Haven't had any chest pain the last 2 days, just about.
Awesome. Well, before I get started, may I see your armband and please tell me your name and date of birth?
Sure. My name is Robert Alexander, born January 26, 1952.
Thank you, Mr. Alexander. I'm here to talk to you about a new prescription Dr. Michael has prescribed for you. Have you ever heard of or taken nitroglycerin before? You may have also heard it called nitro or nitrostat.
Ugh, another pill. No, I don't think I have. What is it?
It's a vasodilator, which means it works to open the blood vessels in your body. When it does that, it does a really good job of lowering your blood pressure, which helps your heart to pump better. Then, after it becomes easier for your heart to pump, your chest pain lessens or can even go away.
Oh, okay. So it's for my blood pressure then?
In a way, yes, sir. This medication is also being prescribed to ease the chest pain that you've been experiencing. You may all, You may not always feel the blood pressure rising, so it's important for us to monitor it often. Nitroglycerin is also very fast acting, so it does its job really quickly.
Alright, so do I take it like my water pill? Just sip it down?
Well, actually, the one that has been prescribed for you comes in a sublingual form. This means that you just put it under your tongue and let it sit there to dissolve. If your mouth is dry at that time, when you go to take it, you can moisten your mouth with some water. You do not want to swallow it or you won't get the best results.
Okay. That's new. How many I gotta take now? Because I already take the whole dang pharmacy.
So this medication is used on an as-needed basis. So you only take it if you're having severe chest pain or if your blood pressure is higher than the parameters Dr. Michael has chosen for you. You will put one under your tongue when you need it, and if your symptoms do not get better in at least 5 minutes, you can take another one and try for another 5 minutes. If your symptoms are still not going away, you can try one more time with a pill under your tongue. Do not go for a fourth one though.
Okay, so I only take it when my heart feels broken? What else you got? Because I'm fixing to miss my show.
All right, I'll be brief, but I want to make sure you understand all the important things that nitroglycerin has to offer before you take it. Are you on any erectile dysfunction medications at home?
Honey, he ain't got no problems. My John works just fine.
I'm just checking because nitroglycerin has very, very dangerous adverse effects when they are taken together. Mr. Alexander, do you understand? This is very serious. You may end up back here in the hospital or even pass away if you mix the two.
My woman won't be happy to hear that. Or maybe she will. I don't know. I hear you. No blue pill and nitro so-and-so.
You also do not want to take any antihypertensives like digoxin, Lopressor, or lisinopril. Also, be sure not to consume any alcohol when you're taking nitro either, okay? Because all of these can cause severe damage and dangerously low blood pressure, which may take your life.
Dang, you're just taking all the fun away from this old man.
I'm sorry, Mr. Alexander. We just want you to feel better and stay that way once you get there. Now, before I go, I do want to mention that you might experience some dizziness, headaches, nausea, vomiting, and weakness, but these are all expected to happen, all right? And if you get a severe headache, you can take either over-the-counter medication to relieve it or get some rest. But these kinds of headaches usually go away on their own in about 20 minutes.
Yeah. You got anything else for me? Because my show's coming back on, darling.
Okay, I'm sorry, but this is very important, so I want to make sure you understand this. Remember when we talked about taking the medications 3 times, 5 minutes apart for a total of 15 minutes?
Yeah, you said 3 pills, 5 minutes apart.
Well, if you feel like you need another one, that means it's time to go to the hospital and come back to see us, okay? You also want to swing by immediately if you feel like you can't breathe, your vision changes, or you spike a fever. Be sure not to drive yourself, and it may be in your best interest to dial 911 and allow the paramedics to help you.
Thanks, honey.
No problem, Mr. Alexander. Now, before you unmute, do you have any questions for me, or do you need anything before I go?
I don't think so. You've been nothing but a doll to me, sweetie.
Okay, well, I'll just be outside if you need anything, and when you leave, you'll get the phone number for Dr. Michael's office. We will also make sure to schedule a follow-up appointment with your primary and give you their information as well.
Thanks, sweetheart.
You're welcome, Mr. Alexander. I'll be back in a bit to send you home.